Assalamualaikum and very good afternoon. I greet to all of you. Today we will have a brief discussion about the microbes that we have selected, which is Rubella. Before we start, I think we should introduce ourselves first. My name is Putri Zara Sofia binti Rahaisa.
My name is Namira Fazana binti Kilo Ismail.
My name is Muhammad Ammar Mustaqim bin Nur Anwari.
My name is Nuraini binti Mokhtar.
My name is Muhammad Adam bin Muhammad Sabri.
Okay. Firstly, what is rubella? Rubella, also known as German measles, is a contagious viral infection that is caused by rubella virus. At first, rubella was considered as a variant of measles by George Merton in 1814, since both of these infections causes red rash as an early symptom. In 1942, congenital rubella syndrome was first recognized by Norman Gray. Next, Amira will explain about the symptoms.
So rubella is usually mild and difficult to notice in children. The symptoms often appear between 2 or 3 weeks after the exposure to the virus. So for children, a red rash is typically the first signs. So other symptoms that appear before the rash are mild fever, swollen lymph glands, runny or stuffy nose, headache, and red eyes. So commonly, adult women affected by the virus may experience aching joint. So if any of the signs appear, refer to a doctor immediately. And if a mother is considering to pregnant, make sure to receive the measles, mumps, rubella, MMR vaccine. Next, I will pass to Amma.
Okay, next I want to share about causes and complications of rubella. Rubella is caused by a virus that is passed from person to person. It can spread when an infected person cough or sneeze. It also spread by direct contact with an infected person respiratory secretions such as mucus. Other than that, it also can be passed on from pregnant women to their unborn children via the bloodstream. An infected person can spread the illness before the person realizes he or she has it. Next, for rubella complications, rubella is a mild infection. Once you have the disease, you are usually permanently immune. In rare cases, rubella can cause an ear infection or inflammation of the brain. However, if you are pregnant when you contract rubella, the consequences for your unborn child may be severe and in some cases fatal. Up to 80% of infants born to mothers who had rubella during the first 12 weeks of pregnancy develop congenital rubella syndrome. This syndrome can cause one or more problems, includes growth delays, defects in other organs, and intellectual disabilities. That's all from me.
Okay, I'm going to talk about the treatments and the prevention. Up to now, there are no specific treatments for the patient who were already infected by the virus. However, the pregnant woman may be treated with antibodies called as hyperimmune globulin that can help us to reduce the symptoms. But there are still no proven data that the usage of the antibodies can eliminate the possibility of the developing babies getting the CRS. Yet there are few simple self-care that we can do when our family members infected with the virus. One of them is by giving them the paracetamol, which can help them to relieve from mild fever. Rubella is a virus, so the antibiotic itself won't work. But this disease can be avoidable by taking the MMR vaccine.
So I would like to add further information about the MMR vaccine. The MMR vaccine is a live virus vaccination against measles, mumps, and rubella, MMR. It was actually an inactive viruses which are not infectious. The CDC informed that it was recommended for the virus to be taken since the early stage of childhood for about 12 to 15 months of age for the first dose. For the second dose, it was for 2 to 5 years old. There's an exception, however, for the vaccine intake. For example, the pregnant women or someone who perhaps have life-threatening allergic reaction to the content of the virus. For conclusion, the reason why we're interested to talk about rubella is because the virus was once invented in Malaysia in the year of 2010 until 2019. Although there is still no treatment, fortunately the cases have been decreased and the last cases have been reported in 2019 was only 111 cases. Who knows when the virus will come back, right? So I think that's wrap up our discussion. Thank you, everyone.